Hi, my name's Simon from Anaphylaxis UK. Can I interrupt you just for a very brief moment before this video starts and encourage you, please subscribe. Also, if you like the video, and I do hope that you will, please put the thumbs up and hit that bell. But really important that we get more subscribers to this YouTube channel. Thanks ever so much. We're going to be talking about weaning, and we get an awful lot of questions from parents about introducing allergies to their child, or if their child has an allergy, and all sorts of questions around breastfeeding, introducing allergies at an early age. How's that done? So if we can have a little chat now, I'll fire some questions to start off, really, if you don't mind. Really, that come in to our helpline at Anaphylaxis UK. But I've talked to Dr. Helen around home allergy tests and the kind of stuff that you get down the high street, and potentially to avoid those sorts of things. But should you be worried about a child with an allergy and take them for a test?
Yeah. So the first thing to say is a lot of babies, a lot of small children have symptoms that look like allergy. Quite often it isn't allergy, and there's other things that are causing that. So I think the first thing to do is talk to your GP. If it sounds like it could be an allergy, they would refer your child to an allergy clinic when they could be assessed. And allergy testing doesn't give you the bottom line. What we as doctors do is take a good history and just understand the symptoms, what potentially triggered them, what might have exacerbated them. And then we think about actually what are the best tests to do, because there's a number of different tests we could do, but none of these tests give a black or white, yes, no, you've got allergy. Unfortunately, it's a little more complicated than that. But with the history, with some tests, sometimes with a food challenge, we can get down to a bottom line. Yes, it's allergy. No, it isn't. And a lot of, probably 80% of parents who think their child has an allergy, 80% of the time, actually, it isn't. It's something else.
And what sort of things would be confused about? Tummy upsets, croup, that sort of thing?
Yeah, absolutely. Or the really common one are viral infections. So children, when they have a viral infection, can have nettle rash, which is the sort of rash you get with a food allergy. And so really easy can confuse that with a food allergy. You imagine that happened on a day when they were first had peanut butter. Parents would naturally assume they were peanut allergic. So that's the common one.
So thinking about that, then, if my child then had the peanut butter and come out in a rash,
Mm.
you then suspect, without having a test, that that child is allergic to peanuts. Should
Yeah.
they then, the parent then just not give them peanut in anything?
Absolutely, because there is a real chance that it is a peanut allergy. The next reaction could be worse. So yeah, if you strongly suspect that your child's had an allergic reaction, don't give them the food again. Talk to your GP, and hopefully your child will be evaluated in an allergy clinic.
And what sort of age would you be looking at to introduce things like peanuts and
Mm.
milk into a child's diet?
Okay, so the government's advice currently is that you should be introducing solid foods around 6 months of life. Um, we disagree with that because we think the evidence base has actually changed, and there's some really good study data from studies like LEAP and EAT and Prevent Now in Scandinavia to suggest that actually, if you introduce these foods early, you can prevent about 80% of allergy developing. By early, I mean between 4 and 6 months of age. And if you look back historically, 50 years ago, that's what our great grandparents would have been doing in terms of the age they introduced solids.
And is that the case for all foods, or would you treat things like peanut milk separately?
Um, all food.
And if there's a reaction, if the child then does come out in that rash, is that the time then you have a chat with the GP?
Yeah, okay. So we know from the data that actually children are much more likely to react in the second 6 months of life than the first 6 months of life. So you'd be very unlucky if you introduce peanut or egg in at 4 to 6 months of age and your child had a reaction. Be very, very unlucky. Much more likely that your child has a reaction if you delay it to the second 6 months.
Feed somebody, a child, how would they, if they've got a milk allergy themselves, for example, or an egg
Yeah.
allergy themselves, how would
Yeah.
they practically be able to feed the child?
Um, that's a challenge, and we have conversations about this a lot in clinic. I mean, the easiest thing is the other parent actually gives them that particular food. Sometimes we have situations where that's not possible, so grandparents, aunts, uncles, etc. Um, but it's important that these foods are in the diet relatively frequently. So in the trials, we've been asking parents to give the food 3 times a week and a reasonable amount of food. Probably actually smaller amounts, but still 3 times a week initially is what you need.
And
And
that's
the
3 times for an egg, 3 times for
yeah,
milk, or
but not a whole egg. So you're talking about a heaped teaspoon of egg or a heaped teaspoon of peanut butter. Um, and with peanuts, really important, it isn't whole peanuts. That's a choking risk in a preschool child. It needs to be a peanut product, so peanut butter that's maybe diluted with water or diluted with some other savory food.
and how about with an egg? Does it make any difference with it's a yolk or the white? Should it be mashed together? Should you try
Yeah.
separately?
Yeah, so it's the egg white that usually causes allergies in the UK, but I just mix it together. So scrambled egg would be a an obvious way of doing it. I mean, egg white is quite rubbery, and there some babies don't particularly like that texture. So scrambled egg is probably the way to go, and well cooked, not
Well
raw.
cooked. Um, can I ask you, Graham, as well about breastfeeding? If a parent has got an allergy themselves, and
Yeah,
the mother is often then concerned that they'd be passing on an allergy to
yeah,
their child by breastfeeding. Is there
yeah.
any evidence to suggest that?
Okay, so this is a really common concern, and usually it's not an issue. So if a mum is drinking cow's milk, small amounts of that cow's milk will get into her breast milk and to the baby, but it's really small amounts. And 99% of babies with cow's milk allergy, it's not a problem. Occasionally it is, very occasionally, but that's normally pretty obvious. And at that time would give mum's advice to go onto a milk-free diet and make sure they've got other forms of calcium in their diet. But that's very, very unusual.
So there'd be a minimal risk, if at all, that the child would in effect catch the allergy by
There is
getting breastfed.
absolutely no evidence that breastfeeding is associated at all with developing cow's milk allergy. Absolutely no. So, I mean, and the advice for mums during pregnancy or lactation is actually eat what they like, and don't worry about it. There's enough other worries for mums
Yeah,
during pregnancy and small babies, but they just should just eat what they like.
really helpful. That's great. Thanks, Graham. I think you've covered a lot there.